တော့ကောင်းတန့်ဝင်ပြီအဲ့တော့ကောင်းတန့်ကိုဖိုက်လို့လိုက်နော်ဟုတ်အဲ့တော့အမဘက်ကလောက်ရမှာကိုတီးတို့ပဲလောက်လို့
ကျအမဘက်ကလည်းလို့ရ
အဲ့တော့ကောင်းတန့်စီတော့
မှာခါလေး
ဟယ်လိုဆရာကောင်းတန့်မောင်ဘက်ကပြောလိုက်နော်
ကြိုက်ပြောလိုက်ရတယ်
တော့မြုပ်လောက်တာ
မမြူလို့လည်းဘက်ကကြား
ရတယ်ဗျဟုတ်
Hello Dr. Countant
ဟုတ်
Can you hear me
ဟုတ်ကြားပါတယ်မ
ဟုတ်ကဲ့မဟုတ်ကဲ့ဆရာအခု Dr. Kampo ကနေပြီးတော့ slide show လေးတွေပြတော့မယ်ဆရာဟုတ်ကဲ့ပါရှင်ဟုတ်ကဲ့ဆရာမြင်ရလားမသိဘူးเนาะ
မြင်ရပါတယ်ဗျ
ဟုတ်ကဲ့ဆရာအဆင်မပြေပြန်ပြောเนาะဆရာဟုတ်ကဲ့
ဟုတ်ကဲ့ပါဗျဟုတ်
ဒီကမောတယ်
ใช่ Dr. Countant နဲ့ Dr. Kampo နဲ့ပဲ那刚才的哇，使用欧卡理查度。我这边嘛，把路弯路跑呢。
ให้น้องกันเป็นไปจ้ะ
呀，这个刚当。
အမဘက်ကပိတ်ထားပါ
မြူးလုပ်လိုက်မယ်နော်
Okay
လုပ်ပြီလို့
လိုက်ပြီဟိုတန်းကောင်းနေတယ်မတန်နေဝင်လို့
yes
လာပြီအဲ့တော့ကောင်းတန့်နဲ့ကံပေါ်နဲ့ဟိုဒီရောက်ဝင်
ဟုတ်တယ်အဲ့ကြောင့်အမပိတ်ထားပါ
ตอนนี้ยังไม่ต้องใช้
အမရဲ့ USB ကားတွေရော
แต่ตอนนี้รู้แล้วว่าจะทำยังไง
မမတော့
จดด็อกิเมนต์
အမတို့ပြောရမှာဟုတ်ကဲ့တယ်လိုက်
အမဘယ်နဲ့လဲ
လုံးနေပြီနော်ဒါကမန်တော့ပြေရရဒါကမန်စတိကပိတ်
ဟုတ်တယ်သူကပိတ်
ရအဲ့ဒါ one side ရဒါကမန်တော့
ทำอย่างอื่นเล่นไปก่อนก็ได้
ဘယ်နာလေးပြန်ပြန်ပြောဖို့ပြောလိုက်နော်ကိုတီးထုတ်ပေးတာပြဟိုတော့ကမုန်းလေးဘယ်နာလေးပြပေး
ဆရာမင်္ဂလာပါဆရာဟုတ်ဆရာကောင်းတဲ့ဟုတ်ဟယ်လိုဆရာဟိုနေကင်မရာလေးဖွင့်လို့ရလားဆရာ
ဒါကမုန်းမျက်နှာလေးတစ်ချက်ပြ
ခဏလေးကျွန်တော်မိတ်ဆက်လေးလုပ်ချင်လို့ပေါ့နော်
ဟုတ်ကဲ့ဗျဟုတ်ဖွင့်ပြီ
โอเคပါကျေးဇူးတင်ပါတယ်ဆရာဟုတ်
Okay. Yeah.
yes.
Yeah, welcome.
ဆရာမင်္ဂလာပါဆရာဟုတ်
မင်္ဂလာပါ
ဟုတ်ကဲ့ပါဟုတ်ဆရာနာတို့စမယ်
ဆက်စမယ်နော်ဆရာလို့
ဆရာဒါဆိုကျွန်တော်စလိုက်မလား
ဟုတ်ရပါတယ်ဗျဟုတ်
ဒါ now start.
Mr. Cameron, yes, now we can start it.
Start แล้วคุณเล่นคนแรก You want to start now?
เก็บไปเพราะว่า
Is gone
ไป
and the leave.
ฟังอีกแล้วก็ได้
And go on now. Yeah, it's not long. It's like.
ဆရာဟုတ်ကျွန်တော်ဂျာရီကနေမိတ်ဆက်ပေးရမလားဆရာဟုတ်ဆရာ intro လုပ်ချင်လားမသိဘူး
ဟုတ်ဆရာမိတ်ဆက်ပြီးလို့ရောက်ဟုတ်
ဟုတ်
Sarakanda is Manali medical doctor.
Yes, Mr. Campbell. Yes, I would like to introduce with Dr. Condon.
Okay.
Yes, Dr. Condon is from Mandalay,
Abba
Myanmar. Mandalay town, Mandalay, yes. Mandalay region. Mandalay region is for Abba Myanmar, yeah. Okay. Yes, so yes, now we can start the presentation. Yeah.
Okay.
Yeah.
Okay, I can start now.
Yes, and now we can start it. Yeah.
Good morning, everyone.
Yeah, good morning.
Today, I would like to talk about the current applications of stem cell therapy in the treatment of chronic diseases. I will start by giving you brief information, and at the end, please feel free to ask any questions, and I'll be happy to entertain them. Let's start with what are stem cells. All stem cells, regardless of their source, have three general properties. The first property is that they are able to divide themselves and renew themselves for long periods. Normally, with about 160 million stem cells existing in our bone marrow. Most of them are considered to be unspecialized. It means that they do not have the form and shape of the normal tissue and organ yet. However, they can give rise to specialized cell type, like change into heart cell, bone marrow cells, and brain cell, depending on the situation. I like to give you the idea of what is the promise of stem cell research. On the left-hand side, we can now grow tissue and organs in the test tube. Many of you may not realize that we're now able to grow skin tissue, blood vessels, and many tissue and organs ready to be used for organ transplantation in the future. Hopefully, in the next 30 years from now, we can grow organs in the test tube, like liver, heart, lung, and so on, to take care of organ transplantation in the future. At present, I'm working on stem cell therapy or stem cell transplantation for treatment of diseases. And on the right side of the slide presentation, we are working a lot on gene, genome, DNA. And in the future, we can understand more about the genetic risk of having diseases and also using gene therapy for treatment of diseases. As most of you probably realize that we are able now to complete so-called International Human Genome Project. So at present, we do understand what are the genetic code for many things in human body. Right now, we can do what we call genetic tests to predict the future health problems by using so-called gene tests. And as you know, gene can control protein synthesis. So in the near future, we'll be using a lot of protein or peptide growth factor for treatment of disease. I want to share with you that there are many types of stem cells. Starting from the day that we have the fertilized egg, we can have what we call single cell embryo or zygote. And after we allow this zygote to develop for 5 to 7 days, we can come up with a stage of blastocyst. From here, you see embryonic stem cell can be derived from this stage of blastocyst. Later on, they develop into fetal tissue cell. And what I like to spend most of my time today will be about adult stem cell. Adult stem cell mean that you can collect on the first day that baby will be born. I understand that most of us understand that we can collect cord blood and also cord tissue for using stem cell in the future. Right now, we understand that adult stem cell can be collected from many other sources, such as bone marrow, peripheral blood, and also many other tissues. This slide shows the classification of stem cell. If we classify stem cell by cell origin, embryonic stem cell derived from the inner cell mass of blastocyst, embryonic stem cell collected from fetal tissue at 5 to 9 weeks of gestation, and adult stem cell are derived from mature tissue. I have to emphasize that embryonic stem cells and embryonic germ cell are considered to be unethical and also can develop a lot of serious problems. So right now, most of the scientists will be focusing on so-called adult stem cell. This slide showing the stage of blastocyst. If you look at the blastocyst picture, you see that there are around 100 small cells called inner cell mass cells. And if we break down blastocyst and take out inner cell mass cells, this can contribute to 3 stem cell germ layers: ectoderm. Ectoderm will later turn into skin, eyes, and nerves. Mesoderm change into bones, blood, and muscle. Endoderm, lungs, liver, and lining of the gut epithelium. If you look on the right part, we can understand more about placenta. And placenta is something that nature creates to protect the baby in the mother's womb. We know that placenta have many sources of stem cells that I will explain in more detail later. Now, embryonic stem cell, in the future, we can learn to isolate the stem cell from blastocysts, and these blastocysts, we can turn them into specialized cells, like the heart cell, liver cell, neuron or brain cell, and blood cell, and then giving to human. At present, because of the ethical issues, we are conducting a lot of embryonic stem cell research, and hopefully we can find a healthcare solution in the next 5 to 10 years later. I'm not sure that some of you may have heard about Professor Yamanaka from Japan. He received Nobel Prize in the last few years about induced pluripotent stem cell called iPSC. This iPSC aims to turn out skin tissue, and by doing so-called genetic manipulation by reprogramming, we can turn skin tissue backward into so-called embryonic stem cell, and later on will be given back to the donor. So if you are interested, can search more information on induced pluripotent stem cell. This has not been approved for any clinical use yet, but in the future, once the research have shown the powerful way to use this iPSC, we can help to treat a lot of chronic disease as well in the future. Now, let's come to the adult stem cell. Adult stem cell has been approved starting from bone marrow stem cell in the year 1968. Now, we have used peripheral blood stem cell as well as stem cell from cord blood to treat blood diseases. Nowadays, we have learned that not only adult stem cell can treat blood disease, we will also have the adult stem cell to treat many organ tissue as well. Let me explain a bit in more detail. Adult stem cell, first, they can make identical copies of themselves for long periods of time. This ability to proliferate is referred to as self-renewal. And secondly, they can give rise to mature cell type that become the specialized function. Okay, let's look at the picture here. Stem cell, let me repeat again. When they go divide, they will make a new copy of itself to store in our body. And the second cells will become specialized cells. In the past few decades, we have found out that there are progenitor cells. These progenitor cells, when they divide themselves, they do not put themselves into stem cell. However, they immediately divide into specialized cells, such as progenitor cells from myeloid progenitor. When it divides, it can turn into white blood cell or red blood cell. Even though bone marrow stem cell has been proved to treat blood diseases, but starting from about 15 years ago, we have learned that stem cell, even from bone marrow, it can differentiate into another tissue and organs. That's why we start to come up with the new field of medicine called regenerative medicine. Let me explain you briefly because if we're going to take a long time to explain in more details, but I try my best to do so. A lot of people wonder why when we infuse stem cell or giving stem cell transplant, how it could become changed into different cells and organs. So we know that there are many factors released by damage that may induce stem cell to turn into any particular tissue. And we now know that there are more than 200 growth factors that can change and activate stem cell to turn into the new organ and tissue. And we also learned that the stem cell, once they become activated, they can migrate and move into the tissue and organs, and therefore stem cell migration will become tissue specific or can be generated after injury or damage to tissue and organ. Let's discuss a bit about the sources of adult stem cell. Let me repeat again. Hematopoietic stem cell derived from bone marrow and peripheral blood and also cord blood have been used to treat blood diseases for more than 30 years. However, because of the lacking of stem cell banking, we are not yet able to do the treatment for blood disease such as thalassemia, leukemia, and lymphoma. However, at this time, I think that we can develop hematopoietic stem cell banking to support AEC community. And once the doctor realized that this hematopoietic stem cell treatment can be used properly to treat blood diseases, we can help a lot of patients with blood diseases. Now, in the past 15 years, we now know that stem cell can be derived from placenta, umbilical cord, not only from cord blood. Liver also have quite a number of stem cells. Fat tissue also can contribute to good source of adult stem cell. I have started to work with baby tooth stem cell starting from the year 2005. And I was surprised to learn that the small baby teeth can produce treatment for bone and joint to improve blood circulation as well as to treat neurological diseases such as stroke and Alzheimer quite efficiently. I have mentioned that the use of stem cell now has led to the development of the new branch of medicine called regenerative medicine. And it said in this presentation that regenerative medicine is a broad definition for innovative medical therapy that will enable the body to repair, replace, restore, and regenerate damaged or diseased cell, tissue, and organ. This broad field covers a variety of research areas, including cell therapy, tissue engineering, biomaterials engineering, growth factors, and transplantation science. Today, we will focus on stem cell therapy. What is cell therapy? US FDA defines cell therapy as the prevention, treatment, cure, or mitigation of diseases or injuries in humans by the administration of autologous. Autologous means that the stem cell collected from the patient, processed and putting back to the same patient. Allogenic. Allogenic means the stem cell will collect from other donors, being processed, and giving back to the recipients. Xenogenic. This practice has been done in Germany and Switzerland for many years, that they use stem cell from animal sources, like maybe some of you have heard about fresh cell therapy derived from the sheep cell, and that has been used for quite a number of years as well. Now, if we are going to give the human stem cell treatment, remember that there are 3 types of stem cell therapy. Autologous means stem cell will be collected from the patient and processed and put it back to the same patient. Allogenic here again means that the stem cell will come from the donors and being processed and given to the patient. In general, if the stem cell that need to be properly matched, using the stem cell from the siblings will get a better chance to be successful and free of side effects. Therefore, if we are thinking about giving allogenic stem cell, the first thing that we need to find a donor that are related donor. For unrelated allogenic stem cell, may be difficult to do the perfect matching. Syngeneic stem cell transplantation means that the stem cell come from identical twin. If you use stem cell from identical twin, then no need to do any match twin. Now, let me share with you the difference between autologous and allogenic. If you use autologous, no need for any tissue matching, no rejection, no side effect known as graft versus host. Engraftment or the reconstitution of the organ will be faster. Immune reconstruction also be faster, and no need to worry about HIV or hepatitis because they will be collected from the donor who will become the patient as well. Now with allogenic, if you take stem cell from any blood sources, you need to do so-called HLA matching. Without HLA matching, it can lead to rejection and the side effect called graft versus host disease. Engraftment and immune reconstruction will be slower, and the risk of HIV hepatitis contamination may be possible. So if we are going to collect from the donors, the laboratory need to check very carefully that the donor will be free of infectious problems like HIV or hepatitis before we are to give to the patient. This just to share with you about human leukocyte antigens or HLA. If you are to do organ transplantation or stem cell transplantation from the blood sources, we need to do HLA matching. Normally, there are 6 major genes, and it's also necessary that we will need to perfectly match these 6 genes all together. If the stem cells are properly matched, it will be given to the patient without any side effect. This diagram, just to repeat that if it's autologous or from the identical twin, no need to do any tissue typing. And if you need to do tissue typing, it's better to use the donor who are sibling or related to the patient. Will be better than using unrelated donor. Graft versus host disease this is a complication due to rejection of stem cell or organ transplantation. We usually use the word GVHD as the abbreviation. Acute means that it affects bone marrow, intestine, and liver. If acute GVHD happens, the mortality rate will be very high. So we have to make sure, I have to repeat again, if we are going to use stem cell from the donors, we need to do properly HLA matching, including organ transplantation. Chronic GVHD usually develop 100 days after stem cell. It may affect the nail and skin. These are not very serious, but it can make patient uncomfortable. During the past 20 years of our therapeutic research, we have been able to understand more about successful cell-based treatment. First, we have to understand that the stem cell that we'll be using can proliferate extensively and generate sufficient quantity of tissue. Just to give you some number, if we are to give stem cell transplantation, the usual dosage that we do recommend will be 1 to 2 million cells per kilogram body weight of the patient. For example, if we need to treat a patient with 50 kgs, we will need to give them around 50 to 100 million cells to be able to make sure that the stem cell can proliferate enough to generate quantity of tissue we need. Now, when we're talking about the total dose, we also understand that normally we will not give the whole number at the same time. Suppose we want to give about 60 million, we usually divide it into 2 or 3 sessions because we do not want to waste the stem cell can be given in too many amounts at the first time. We have to understand that when we give the stem cell, it needs to be differentiated into the desired cell type, survive in the recipient, integrate in the surrounding tissue, and function appropriately for duration of recipient life. So that's what I can share with you, some of our research in some of the many chronic diseases. Now, homing and engraftment. Once we give stem cell, we have to make sure that the stem cell can migrate into the damaged organ that we need to repair. We have many ways to understand how homing effect can take place. And when they find their way into the damaged organ tissue, they must be able to engraft. Engraftment means that the stem cells are functional properly in the desired tissues. Well, this is just a small diagram to tell you that suppose we infuse stem cell into the blood circulation, we will need some compounds like SDF and CXCR4 receptor activation to make sure that the stem cell can migrate into the body tissue and organ and repair the damaged tissue and organ as well. By doing stem cell research in both animals and human study, we now understand that the mechanism of stem cell work by 3 major mechanisms. The most important one is called paracrine effect. So, what does paracrine mean? When we infuse stem cell will release growth factors and substance called cytokine to stimulate the organ and tissue during their passage into our blood circulation. And here again, we start to learn now to use appropriate growth factors and cytokine to treat diseases. In the future, we will be using a product called exosome, which can come out from the mesenchymal stem cell that broken down into exosome to produce so-called paracrine effects. The other part that the stem cell can do is called angiogenesis or vasculogenesis on your left-hand side. Normally, it will take about 4 weeks that stem cell can put making more collateral circulation, so-called vasculogenesis. And that's also help for those patients who have peripheral arterial diseases to get better. Now, if we want to do what we call tissue regeneration, it will depend on the organs and tissue that we are talking about. Okay, the other aspect that stem cell called MSC can do, it can connect with many immune cells like NK cells, T cell, B cell, and dendritic cell. So this special MSC, which I will talk a little more, will also be useful to promote immune system and fight against cancer and certain viruses. We believe that bone marrow stem cell constitutes so-called the natural renewal system of the body. As if we can provide the release of stem cell from bone marrow, it might be enough to help the body to repair itself and maintain greater health. I have to remind you that the tissue and organs in our body have different turnover rate. For example, intestinal mucosa can repair itself in 5 days. Pancreas, 3 months to 4 years. Lung, 4 years. Heart, 15 years. Brain, 15 to 30 years. So therefore, any tissue and organs that can regenerate itself, when we use stem cell, they will see the effectiveness in the shorter time. For example, if I have patients who have intestinal ulcer, it can be healed within 5 days. If I want to treat diabetes, it usually takes about 3 months to see the result. And if I need to treat lung, heart, and brain, I will need to give them the higher dosage and serotype treatment to make sure that we can shorten the time to repair itself from 4 years into about 4 months or 6 months. So here again, I like to show this slide to explain that we can divide the tissue and organs in our body into 3 major groups. The first group on immediate left-hand side will have so-called high cellular turnover, high regenerative potential. These organs include blood cell, mammary epithelium, gut epithelium, vascular endothelium, and the epidermis or skin tissue. So if you want to treat blood disease, gut epithelium problem, vascular endothelium, and skin, you will see the significant improvement within 4 to 6 weeks. Now, if we move to the group of organs that have low cellular turnover, high regenerative potential, such as liver, small blood vessel, skeletal muscle, pancreas, adult cortex, it usually takes 6 to 12 weeks to see the significant improvement. Now, let's look at the last column, which are low cellular turnover, low regenerative potential, like lung, brain, kidney, retina, heart, and spinal cord. We can expect the significant improvement within 4 to 6 months. But this doesn't mean that the patient will not feel better after the first 1 or 2 weeks. But what I like to explain that these organs are difficult to repair. So if we want to see whether the stem cells are effective enough, we need to evaluate the patient 4 to 6 months after the treatment. Now, I also believe that health is a balance between cellular loss and tissue renewal. Disease formation is a result of an imbalance between cellular loss and tissue renewal as well. So I have been working a lot in anti-aging because my assumption will be that if we can make tissue renewal faster than cellular loss, we may lead to so-called anti-aging effect. We have understand a lot now that when we are getting older, the old people do not usually respond to stem cell therapy as well as the younger children. And we also understand that if we are going to do autologous treatment using the patient's own stem cell, the information that we have, those who are more than 55 years of age, their own stem cell are usually not effective enough. So therefore, for older people and for more serious people, I suggest that we will need to use stem cell for the donor. As you can see in this graph, when newborn will have one stem cell for every 10,000 cells exist in the body. When we become teenage, it becomes 1 per 1,000. For people who are around 30 years old, we will have one stem cell for 250,000 normal cells. And the number will be decreasing. Like when we become 50, it will be 1 per 40,000. And if someone who as old as more than 65 years old, it becomes 1 per 2 million. We also realize that if we will compare stem cell from children and stem cell from adults, the children stem cells are stronger and more effective than the adults. Okay, I will like to explain a bit about the autologous process from our own peripheral blood circulation. This autologous transplantation from peripheral blood has been approved in many countries for the treatment of the disease shown here, like leukemia, lymphoma, multiple myeloma, and so on. The collection process usually takes about 3 hours. Side effects are rare and mostly minor. I have to collect my own peripheral blood stem cell about 15 years ago. And after collection and laying next to the machine for about 3 hours, we do have about 150 ml volume of peripheral blood stem cell being collected. And the collected sample can be used for cell count and culturing. Now, in brief, this collection process starts with using the machine called apheresis to collect the stem cell sample, and we can keep it in liquid nitrogen before we'll be using for transplantation. Okay, this is how the system can be working. The next slide will be summarized about this process. The process starts from collection and also processing, number 2. Number 3, cryopreservation. What does it mean by cryopreservation? Cryopreservation mean keeping the stem cell in liquid nitrogen, which has a temperature of minus 190 degrees Celsius. And this preservation can keep the stem cell viable at least for 25 years. And if we need to give back to the patient, we can thaw and reinfusion back to the patient. I have recommended many of cancer patients who are going to undergo chemotherapy or radiation to collect their own stem cell first and keep it. And after they get the complete course of chemotherapy and radiation, they can use their own stem cell to help them to improve their bone marrow suppression and also help them to get the better survival and also producing them stem cells to repair themselves. Due to limited time, let me come up to the last type of stem cell that I will speak today. This is called mesenchymal stem cell. In brief, we call it MSC. MSCs were first isolated from bone marrow by Freudenstein and their colleagues in 1976. Later on, we proved that MSC can be isolated from various cell types, including adipose or fat tissue, delta pouch, baby teeth, peripheral blood, placenta, umbilical cord tissue, and many other sources. The reason that most scientists, including me, who working with stem cell, we prefer to work on so-called mesenchymal stem cell because they have a lot of good properties that being shown in this slide. The most important one that it will possess so-called immunological privilege. That means that this type of stem cell do not have HLA antigen class 2, which respond for rejection. In brief, it can be given from the donor into any other recipient without having to do any matching. Similar to blood group O, we can use blood group O to anyone with other blood group type. This immune system modulation also exists with this MSC. And we have been using this type of MSC to treat autoimmune disease. In addition, it can change into many tissue and organs, around more than 100 types, including the brain, the heart, the liver, and so on. According to the past 25 years of research, it had proved to be quite safe, no serious side effects if we use it carefully, and also there are no ethical or religious concerns. So therefore, I would like to call for your attention to learn more about this special type of stem cell called MSC. If you have time, you can look in the literature at this review called mesenchymal stem cell as therapeutics. And right now, there have been many other research that prove that it can be very useful in the near future. This picture shows the mesenchymal stem cell surface marker. If you look very closely, it looks like a skin fibroblast, and this can turn into other tissue and organ once it becomes activated. Normally, when we classify stem cell, we usually use so-called stem cell surface marker. STRO1 cell surface marker is the specific marker for mesenchymal stem cell. So any mesenchymal stem cell has to exhibit so-called STRO1 cell surface marker. This is a brief diagram to show what we call mesogenic process. That means that if mesenchymal stem cell can be activated properly, it can turn into several organs and tissue, including bone, cartilage, muscle, bone marrow stroma, tendon and ligament, even fat tissue and connective tissue. In the past few decades, a lot of researchers work on so-called umbilical cord tissue stem cell. I have to emphasize here, not umbilical cord, but is umbilical cord tissue. The most important area that we collect is called Wharton's jelly. If you look in this slide on the lower bottom, you can see that this is the where we can collect stem cell from Wharton jelly. This dental pulse stem cell have been proved that it exists in baby teeth by an American dentist called Dr. Sang Tao Chi. In the year 2003, he noticed that his daughter baby tooth should consist of stem cell, and he proved that he can develop mesenchymal stem cell from the baby teeth, which normally we can use the one without molar teeth. The other thing that we can be using is so-called impact tooth. For those of you who still have impact tooth, once you go to extract impact tooth off, that you can also isolate stem cell from impact tooth as well. This is an example of the clean room class 2, which has been accepted as the standard for stem cell laboratory. We have the clean room and also the area which is safe and clean, and we can collect the stem cell using this facility. Okay, here again, this is a picture of mesenchymal stem cell, which with the ability to develop into the wide length of tissues organ. Okay, let's discuss now that I think many of you have heard that stem cells are still new. I have to debate against that concept because we have been using hematopoietic stem cell for treating serotype cancer, bone marrow failure syndrome, as shown in this slide, and also the disease called metabolic disorders, which also shown in this slide. Immunodeficiency syndrome, which has shown in this slide as well. Next, please. Now, the one that I am interested most will be using stem cell for treatment of thalassemia and other related like sickle cell anemia. Now, in the field of regenerative medicine, we are trying to help to treat many diseases which have not yet been able to treat correctly by conventional medicine. Stroke will be one of priority. Alzheimer's disease, bone degeneration, liver disease, multiple sclerosis, diabetes, Parkinson's disease, ALS, heart disease, spinal cord injury, and also several other problems, including muscular dystrophy. I would like to say briefly about the experience in using stem cell treatment for diabetes. Mesenchymal stem cell therapy may help patients with type 1 or type 2 diabetes by optimizing their health and improve their quality of life. Stem cell therapy may help to control blood sugar, but I believe that we should use a lot more to treat diabetes complications such as heart disease, peripheral vascular disease, diabetic neuropathy, diabetic nephropathy, which many of them will require a lot of dialysis. Vision problem, including diabetic retinopathy and glaucoma. Mesenchymal stem cell can have been proved even using from the fat tissue that it can turn into insulin, somatostatin, and glucagon expressing cells. If you have enough time, you can look in more detail about this publication that work on therapeutic potential of mesenchymal stem cell for diabetes. This also and the good review paper on mesenchymal stem cell therapy in diabetes mellitus, progress and challenge, which has a lot of promising data that one day we can use a lot more of stem cell in diabetic mellitus and its complication. All of us understand so well about type 1 diabetes and type 2 diabetes. If you are going to use stem cell to treat type 1 diabetes, it's going to be much more effective because, as all of us know, type 1 diabetes will be caused by pancreatic tissue insufficiency. So there have been many research and attempt to grow islet cell in order to help to correct the problem of diabetic type 1. For diabetic type 2, it's mostly due to so-called insulin resistance, and that have led our group to work by using fat stem cell. We found out that fat stem cell contain that specific adipocyte called adiponectin, and this adiponectin will lead to insulin sensitivity. So therefore, in the near future, we will start to hear more about of this peptide called adiponectin. For diabetic ulcer, I think this is going to be used a lot more because it can help a lot to heal the ulcer that sometimes is not easy to be healed. And many of the patients will need to be amputated. And for this patient, the patient has been recovered only 8 days after injection around the wound area. I also like to give some suggestion that for liver disease, we should try to use mesenchymal stem cell for liver disease such as cirrhosis and fatty liver. And liver cell is able to regenerate itself quite well. So therefore, if we take one lobe of liver cell, liver tissue off, it will grow right back within 6 weeks. So therefore, let's look more in detail about using stem cell for liver disease treatment. Again, these are the good review paper about mesenchymal stem cell therapy for liver diseases. And cirrhosis, we have been using for the treatment of liver cirrhosis, which could result, and it result in regeneration of liver tissue. let's move to the topic of Alzheimer. Stem cell can be genetically modified and able to migrate after transplantation. So the focus now will become that we like to have more of the so-called tissue that provide nerve growth factor. This nerve growth factor or NGF can counteract cholinergic neuronal death, stimulate cell function, and improve memory in animal model. And it has been used in some limited study that it has quite some benefit in patients with Alzheimer's disease. Here again, this is also a review article on stem cell therapy for Alzheimer's disease. Please have a look in more detail for this full paper. This is also another good review on application of mesenchymal cell for the other aspect of disease called osteoarthritis. The osteoarthritis is quite common, and one of the near future treatment we will be able to use mesenchymal stem cell for treating joint diseases. At present, I'm sure that many of you are familiar with using PRP, which derive from platelet rich plasma of the patient and put it back to them. PRP has been proved to have some benefit, but for the study comparing PRP and mesenchymal stem cell, MSC study proved to be more powerful, and it can help the cartilage to grow and also to produce hyaluronic acid as well. This is the study conducted in Australia. This picture shows the change before treatment, surgery treatment, and 5 months after treatment of osteoarthritis in the knee joint. And this is also the comparing the pre-treatment and 6 week post-treatment of a patient who's suffering from cartilage fissure. Okay, due to limitation of time, I also like to talk about mesenchymal stem cell for treating stroke. In Thailand, stroke becoming more and more prevalent. On the average, we have at least around 70,000 stroke patients every year. And because many of them are bed, that will become quite a long-term problem for the family and for the society as a whole. So we have conducted many research, and this is one of the research that being done by a group in South Korea. They have been using so-called autologous mesenchymal stem cell transplantation in stroke patients. And the finding proved that it can improve recovery from ischemic stroke in human stroke patients. This is also a good paper to review mesenchymal stem cell therapy for ischemic stroke. Just to summarize, according to the research experience done all over the world, and there have been quite a number of clinics offering this treatment as a compassionate use, it turned out to be that the best period of time to offer the stem cell therapy should be within 6 months after stroke onset. Because if we wait for too long, the degeneration process will lead to fibrosis, and it will be too difficult to reverse the patient back to normal. And this is also the current state and perspective of stem cell therapy conducted in European countries. is also quite a detailed systemic review of literature in preclinical research on stroke. Okay, now with hemorrhagic stroke, we can find a good benefit of offering mesenchymal stem cell. But in our limited experience, treating ischemic stroke is going to have more efficacy than hemorrhagic stroke, because with hemorrhagic stroke, we will have the problem of penumbra effect, which can also lead to a stroke, recurrent, and so on. Well, I think I have been talking a lot so far, so I like to end my presentation by quoting Alan Kay from Syrup Park, that the best way to predict the future is to invent it. I would like to see a lot of research collaboration to be done in AEC countries, especially with Thailand and Myanmar. So I like to welcome any question, and I try to entertain them as much as I can. I like to start with the question and answer now.
Me.
Hello. Any question? Comment? Any questions so far?
Firstly, your presentation is so nice, sir. Currently, I don't have a question now for this topic. Yeah.
Okay.
Your presentation is so nice and it's easily understandable about this field of immersive. Media civil. On mute လုပ်ထားတယ် mute လုပ်ထားဖွင့်လာ
ทำไมอ่ะเองได้ไหมเราไปซื้อกาแฟได้ไหม
Hello, Dr. Kamo. Can you hear me?
Yes, yes, very well.
Oh, may I ask the question?
Sure.
Yeah. My first focus is for the bone disorder.
Uh-huh.
Bone, yes. Now I understand your stem cell is we can change the some systemic disorder. So I firstly want to do a bone disorder. So
Both. Yes.
bone, yes. So I understand your lecture is for the osteoporosis.
Okay. The
Yeah.
first group that I recommend will be osteoarthritis or joint problem.
Yeah, joint problem.
But we can use it to treat osteoporosis and also other back pain problems.
Back pain problem. Okay. And then my second focus is the skin disorder. Some genetically skin disorder. Can we use the stem cell? Skin.
Okay. For skin,
Yeah, skin.
most of beauty doctors
Yeah.
they like to use it
Yeah.
to improve the skin complexion
Yeah.
and also treating scar.
Scar.
And but I also like to recommend the treatment for psoriasis.
Oh,
Which is
psoriasis. Yeah.
that also very useful to you.
Yeah. Psoriasis is important for the skin specialist. So we can use the stem cell for the psoriasis.
Yes.
Okay, thank you. And for the liver, so for the cirrhosis final stage,
Okay.
for the cirrhosis of the patient final stage, so we are consider the
liver, yes.
So can we consider the liver transplant or the stem cell therapy?
Okay. Now I will try to explain slower. With
Yeah.
liver disease,
Yeah.
very common in our part of the world.
Yeah.
So to start with liver cirrhosis,
Yeah.
we have good result if we are working for those who still have not too severe
Oh, not
liver
too
cirrhosis.
severe. Okay. So for the
And then
severe, yeah.
I prefer to give stem cell as an option before liver transplant.
Okay. So
If you have patients who waiting for liver transplantation,
yeah.
I strongly recommend them to try stem cell therapy first.
Okay.
It's safer, cheaper, and no need to wait for the proper donor.
Okay.
And the other group that I like all of you to concentrate on is called fatty liver.
Oh yeah.
Fatty liver is become more and more serious, and we have very good result. More than 70% of the patients will be quite completely satisfied with the treatment.
Yeah. Because in here, Myanmar, we had a most percentage high of the cirrhosis, liver damage. I found especially for the middle class and upper class because of the alcohol. So liver damage, we got a lot of the patients liver damage problem. Okay.
Yes, and we can help them.
Okay, thank you.
Because the liver transplantation will be difficult to do.
Yeah.
And the other group that I like to recommend is kidney failure.
Okay.
If the patient will have GFR higher than 15, we can expect good result.
GFR.
Cobra filtration rate.
Oh yeah.
If it's higher than 15, we can predict that the patient will not require kidney dialysis.
အဲ့ဆိုဆရာကောင်းတဲ့ကျမနားလဲတာတော့ final stage တွေမှာတော့ stem cell ဘာမှတိတ်လို့မရတော့ဘူးကျမတို့ transplant ပေါ့နော် final stage တာသူက before final stage မရောက်ခင်မှာတော့ကျမတို့ early damage တွေမှာတော့ stem cell ရတယ်လို့ထင်တယ်ဆရာဘယ်လိုထင်လဲမသိဘူးဆရာမေးကြည့်ပါကျမနားလဲတာအဲ့လိုနားလဲလိုက်တယ်
Okay, and for serious liver disease,
yeah
we can try because if nothing available for them, we can try stem cell.
oh we
And
can
you'll be surprised to learn that many of them can get a good response as well.
okay so for my understanding stem cell is preferable for genetically disorder or systemic disorder. Which one is better for stem cell?
Right now,
yeah, because in the
I recommend to use it for chronic disease with degeneration of liver, tissue, and organ.
Or degeneration.
Yeah, like degeneration of the liver, degeneration of brain, bone, blah blah blah.
I see. ဆရာကောင်းမေးပါဦးသူကတော့ degenerate ဖြစ်တာတွေကိုပို့ပြီးတော့ stem cell therapy ကိုသူကတော့ပို့ပြီးတော့ပြန်ကောင်းနိုင်တယ်လို့ပြောတာပေါ့နော်အဲ့တော့ကျမတို့ degenerate ဖြစ်တဲ့ disease တွေကိုပြန်ပြီးတော့စဉ်းစားရမှာပေါ့ဆိုတော့ degenerate ဖြစ်တဲ့ disease တွေက systemic ရှိမယ်autoimmune တွေလည်းရှိရမလားဆရာ degenerate
autoimmune တွေလည်းရှိရဟုတ်ကျွန်တော်အဲ့ဟိုလေးတစ်ခုတည်ချင်တာကျွန်တော်မေးလာမယ်နော်
ဟုတ်ကဲ့
ဒီ how to treat diabetes neuropathic ulcer after 8 days after 8 days the diabetic ulcer totally recover how to treat a specific detail to these diabetic neuropathic ulcer because in our country there are so many diabetic food and diabetic neuropathic ulcer problems in Myanmar that's why I would like to know about how to treat this diabetic neuropathic ulcer in stem cell therapy.
Okay, actually, I like to give more details. The stem cell is a part of it. We can use what we call growth factors derived from the patient PRP as well as from stem cell broken down. Right now, for diabetic ulcer, we can giving like a topical preparation to spray over the wound. And by using what we call epidermal growth factor and some other growth factors like vascular endothelial growth factor, we can heal the wound or ulcer of diabetic patient. On top of what we are doing in the conventional way. So for kidney failure, I strongly recommend that we should offer the stem cell given intravenously before we put them on dialysis. And the good prognosis will be for those who have glomerular filtration rate or GFR greater than 15 up. We see very good result.
15
1.5.
Oh, 1.5.
Yes.
GFR နဲ့
Yes.
တိုင်း
Or
လိုက်
more.
ဆရာဆိုလိုလိုက်တာကဟိုဘယ်တော့ PRP ကိုထုတ်ပြီးတော့သူကပြန်ပြီးတော့ဒီမှာပြန်ပြီး spray လုပ်တာ growth factor ကို spray ပြန်လုပ်တယ်ဆိုတဲ့သဘောကိုပြောချင်တာ
သူက growth factor diabetes ulcer မှာသူ growth factor ကိုသူကပြန်သုံးလိုက်တာပေါ့နော် growth factor ကိုသူပြန်ပြီးအနာကျအောင် growth factor ကိုပြန်သုံးလိုက်
stem cell
ရှင်
stem cell ကိုပြန်သုံးတယ်ဆိုတော့အဓိကတော့ PRP နဲ့ပဲ growth factor ကိုယူပြီးလုပ်လိုက်တဲ့သဘောပေါ့နော်
ဟုတ်တယ်သူကယောဂပေါ်မှာမူတည်ပြီးတော့ဒီ stem cell မှာ variety ပေါ့နော်သူက mesenchyma ရှေ့ကထုတ်ထားတာရှိတယ်နောက်သူတို့အဲ့ပါ myocyte တို့ပါတော့အဲ့လိုသူ့ရဲ့ဒီမတို့ fetus တွေက origin တွေကိုသူကပြန်ပြီးတော့ regenerate လုပ်လိုက်တာပေါ့ဆရာ
ခုနက
Okay, what I would like to suggest
yeah
after this conference,
yeah
we can form the meeting for stem cell and diabetes treatment as a second
oh
for the second time,
Thank
because
you.
I like to explain that we can use stem cell for today for many diseases, but the treatment we also need to understand more about other aspects, like if we want to get rid of the if we want to improve the blood circulation, we can also use IV vitamin like vitamin C, or we can use also ozone for treatment of diabetic wound as well. So I think we should form the other meeting on diabetic and complication. So I can give you more detail of the example, but I like to focus today that not only stem cell that we can use, we can also use other cell therapy products like growth factors that can be registered even as cosmetics and apply over the skin. And we have enough research to support that.
ဆရာကျောင်းရဲ့ retired professor လေး my retired professor about age 7080/80 they are now concerning about the anti-aging anti-aging
Yeah.
agent yeah
Okay. I also believe that right now we are coming to the old people to take care of, and I like them to live their life without being dependent on other people.
okay
So the concept of anti-aging treatment will first, we want to protect their brain
Yeah.
to have stroke,
yeah
no Alzheimer. We have to increase their immune system to prevent from cancer or infection.
yeah
We also have to help them to repair other tissue and organs. So anti-aging doesn't mean to make us young forever. I like them to become healthy and also live their life in the proper way. And here again, that will be a very exciting topic that we can spend time to explain
yeah
what are aging process and how we can measure aging. Right now, we have many ways to define aging. So therefore, that also can be forming of the interested group, and I'd be happy to talk only about stem cell and anti-aging for those who are interested.
okay
That will be very useful.
Okay.
Because with COVID, I cannot travel, so I'd be happy to help to explain in the area that you need. For today, it's just the introduction that I share with you that stem cell is a great promise, but we need to understand more of other system as well. For example, if we want to treat COVID at the later stage, as you know, COVID in the later stage, it affects the lung. We have now invented the product that you can inhale into the lung and repair it. It's called exosome. So that's something that we can also offer the support in the easy way that can be accepted by conventional doctors.
ဆရာဘယ်လိုနားလဲလိုက်
So I think
COVID မှာဒါထိတယ်ပေါ့ပြီးလို့ချင်းသူက lens ကိုဒီပြန်ပြီး regenerative ဖြစ်ဖို့အတွက်သူပြီးတော့ပြောတဲ့သဘောမျိုး
yes
ဆရာမေးပါဟုတ်မေးပါကျွန်တော်လည်းဟိုတေချာကြီးဟိုလို detail ကိုဆရာတချို့ stroke တို့ဘာလို့ကျတော့သူကဟိုရီဝက်ဖတ်ခိုင်းတော့တာဆိုတော့ research တွေပဲဖတ်ခိုင်းတော့ဆိုတော့ကျွန်တော်လည်းဟိုမေးချင်ပေမဲ့ဘယ်လိုမေးရဖြစ်နေတယ် research တွေဖတ်ပြီးမှပဲတေချာမှပဲမေးလိုက်တော့
and Dr. Kambong, Dr. Kauntan is appreciate you very much and yeah
most welcome.
Yeah.
Okay, so we will pass.
And now 11.
Okay. Thank you for all.
And 下刚ဘာမေးအောင်လဲဆရာ
ဟုတ်မေးတော့ပါဟိုကဒီမှာပဲနောက်တစ်ချိန်ကျမှပဲတည်ကျင်တာထပ်မေးလိုက်တော့မယ်
Dr. Kongtan from the Mandalay Apopoma, he is interested in your subject and he will participate in the next section.
Okay.
Yeah, because he's ကိုဟိုကပြောလိုက်တာအမတို့ပြီးပြီဆရာကောင်းကဟို session သူက2မှာသူဆက်မယ်တဲ့သူဝင်နားထောင်
Okay.
Hello.
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 Hello. Yes, Dada.
Yes.
Yes, thank you for your presentation. Yes, this session. So we made the session 2 in 4:30 p.m. or today.
Okay. For today.
So
Yes.
let us stop the presentation. Do you have any yes? Do you have any question? Okay. Thank you for Dr. Kantan. Yes. Thank you for joining.
Okay. Okay.
Yes. So yes.
Okay. Okay.
Separate yes this session, and we will start the session 2 in yes 4:30 p.m.
Okay. Okay.
Thank you.
Talk to you soon.
Yes, sir. Thank you for.
Okay. Bye bye.
No, bye bye.
Miss on bye bye
ဆရာကျေးဇူးပါခင်ဗျာဟုတ်
ဟုတ်ကျေးဇူးပါ
ဆရာကျေးဇူးပဲ
ဆရာကောင်းတဲ့ကျေးဇူးပါ
ဟုတ်ကဲ့ပါဟုတ်ကျေးဇူးပါ
session 2ကြရင်ကျွန်တော်ဆိုမယ်ကျွန်တော် video recording နဲ့လုပ်ထားပေးပါတယ်ဟုတ်
ဟုတ်ကဲ့ပါဟုတ်ကျေးဇူးပါဗျ
ကျေးဇူးတင်ပါကျွန်တော်ပြီးသွားရင်ဟုတ်
Nila?
share ပေးမယ်
Hello,
Yeah.
Dr. Nila. In the next session, Dr. Kampon will change the topic. So Dr. Kwantan, he doesn't, so he can listen to the new one. Okay.
Okay.
Thank you
Okay. We are now
Okay. Thank you.
Yeah.
Thank you.
See you.
Okay. See you later.
Yeah.
Bye.
bye bye
Bye.